initially, maybe when we are in the denial stage, we thought that Mati is just a late talker because his other siblings, my daughter was already in college, and the other one is already in senior high school. So he's the baby of the family. And we thought, late talker lang yan. So what we did was, we enrolled him at the Gymboree Play for additional social interaction. And then we cut off his playing time on his iPad. Okay, but there was very little improvement on his vocabulary. And when he was about 1 year and 6 months, we decided to seek professional help. We voiced this concern to his pediatrician, and we were referred here at the CDP. So they first asked us to undergo, Mati first undergo the hearing test, and then after he was given the clearance, and then Mati was screened. It was done by a fellow, I think. Okay. And he received a failed score with noted concerns for his speech. He was then further seen and assessed by, luckily he was seen by Dr. Navarro, and he was given the diagnosis of developmental language delay. So the recommendation for my son was to undergo occupational therapy and speech and language intervention to specifically address his expressive and receptive language skills. So looking back, my husband and I were very lucky because we already have the facilities and the expertise here at the medical city, and so we were able to get the slots for my son's therapy immediately. And then before he turned 2, there was already a noticeable improvement on his vocabulary, very wide vocabulary actually. And he was able to communicate with us already. Less na yung tantrums because he can tell us already what he wants. And when Dr. Jackie asked me to give a little speech, I immediately agreed because this is a way of saying thank you to the center, to the staff, to the doctors, and of course to the teachers who helped a lot my son in a pre-kinder at the Bannister Academy. He gets along well with his classmates and has no problem with his social activities. With this, yes, I would like to thank the center for the very early diagnosis and for continuing therapy, help that has been given to my son.
Maybe he likes to be remembered as a lolo. But I like to be remembered as a teacher and a storyteller. Dr. Santos, Phil, Jackie, Stella, Kiki, Roy, all the developmental pediatricians, members of the G60, guest parents, and above all, those who are responsible for bringing us together here, the children. Let me tell you first about pediatrics and pediatricians. When I was going through medical school, typically of all students, there are disciplines that you immediately rule out. There's disciplines that you think you would like to try them. And then eventually you decide on one, or a decision is made for you by your feelings, your intuitions, and your experiences. very early on, I decided I did not want to be a surgeon. Uh, I felt that the surgeons were very skillful, but I did not get enough warmth from the surgeons. Our CMO, Chief Medical Officer in Guam, when I asked him to tell me his story as to why he appeared in his radar screen and so on and so forth. Dr. Mike, di ba? Mike Cruz. Said he was fascinated by our value proposition, patients as partners. Mike Cruz is a surgeon. He served in the military because he wanted to give something back to America. And then he ran for politics and became a senator in Guam. The reason for that is he says that the Guam health system is full of problems, and he figured that instead of just complaining, he would do something about it. And the best platform to do something about it was to be in policy. That's why he ran for politics. Because doctors, I'm sure without any malice, he said, given all the education and the training and the skills we have, and given Philippine society's description, una ang Diyos, pangalawa ang doktor. Can you imagine? We are number 2 to the Lord. That's okay. We don't realize that we are in a very powerful profession. And then Mike Cruz says, I was fascinated by your proposition, patient as partner, because partnership is a relationship of parity. So he said, how did you arrive at the value proposition that we are equal to the patients? We want the patients to be equal to us. Well, we said, beneath the white coat, pareho lang ang pagkatao natin. That's what makes us the same. That is the meaning of our value proposition. Anyway, he said, I found it very difficult to accept that description since I'm a surgeon, and surgeons think of themselves as gods and they expect to be adored. When he told me that, Dr. Sarmiento was by my side. I said, yes, indeed. Doctors think of themselves as God, not just surgeons, cardiologists too. Although I love kids, I truly love kids. But I figured I may not be able to handle sick children emotionally. Thinking, as I face sick children, there but for the grace of God might be my kids. So I said, maybe I cannot handle it. But I want to tell you that in my life experience, the high point being when I was Secretary of Health. When you're Secretary of Health, you deal with many organized medicines, you know? Some College of Surgeons, College of Cardiology, all sorts of specializations and specialties. And the high priests of the Philippine Medical Association. I had trouble with all of them. What was the source of the trouble? Because all doctors think of themselves as God, and they expect to be adored by their patients and by the Secretary of Health too. And by the patients, they will tell you, I've spent time, talent, and treasure to get to where I am. So don't bother to ask me questions, just follow what I tell you. Sometimes, if they are as smooth as Dr. Ramos, they will not tell you that frontally. They will say, trust me. Just trust me. It's a good way to express trust me. But trust is never given. It is always earned. And the way I believe the most effective way to earn trust is by a relationship of parity, because among other things, a relationship of parity connotes sharing.